Assalamu alaikum. Good afternoon. Welcome to Medical Device Classification Workshop. In today's workshop, we will cover the following 4 topics in detail. Introduction about the combined medical device term to cancellation. What to classify, when, and how many times. Classification requirement and how to apply. This is our website. You will get all update information about the medical device. The first topic is introduction about the combined medical device term to cancellation. Based on circular number 29, the process of combined medical device importation requirement, it has been uploaded in our system. And the update of chess code we will find in our website. Why we do the classification? If you see the green circle of the medical device overlap with other products, this is the purpose for the classification. Topic number 2, what to classify, when, and how many times. What should be classified? Number 1, not a new product, and if it's a new product, you have to classify. Consider to herbal ingredients. Depend of the claim. If there is any claim that's similar to pharmaceutical product, it's need for classification. Single-use medical device may be objective to the classification. If there is any offer team, if there is any request from the offer team for the classification, then you have to submit for the classification. If it's not medical device and you want to submit for the medical device for a classification, you can submit it. You will get a letter from us that is medical device or non-medical device. What should be classified? In this, this is the list of the product which is need to classified or not need for classification. When you need for classification, before import or submit an offer system, and when you will apply an offer after getting the classification letter. Okay. Number 3, classification requirement. You can medical device form our website. Now I will start to explain each. Free sale certificate must be issued from the authority in country, including the following: manufacturer, product name, and yes.
Okay, yes. If you can just hold a while, I think the internet connection is not stable. Let's just give it some time to be more stable, because this is the most important part of the presentation. Can you try check to speak now, please?
Can you hear me?
Yes, please continue.
Okay. The free sale certificate must be issued from the regulatory authority in the country of origin, including the following: manufacturer name, product name should be signed and stamped. Okay. The free sale certificate or registration certificate from the one of reference country. First, I have to check the expiry date, then the issue for the notice to pay should be active. If there is any relationship letter between legal manufacturer and physical manufacturer, you have to provide it. to avoid the rejection for application. The Quality Assurance Certificate, ISO 13485 or CE mark, should be verified, and you know how to verify the certificate. Artwork or intended use issued from the manufacturer explaining the mode of the claim of the product. Artwork should be including the manufacturer name, the product name, and the country of origin. Should be clear in Arabic and English. The product catalog or the leaflet from the manufacturer explaining the mode of action. Mode of action should be clear, and the mode of action should show how the product is worked. Declaration from the manufacturer is showing the ingredients of percentage of the product. Now, how to apply? First thing, based of the new circular number 18, the new link, this is the new link for appointee. As you know, the appointment, you can submit in your appointment for 3 files only. Each file you have to send in different emails or separate emails. From last year to until now, the submission of medical device classification application through the emails only. You can submit your document by email. From April 2021, we start collecting the fees. We have 2 types of the fees. Regular for the normal 20 BD, and for fast track it's 40 BD for each type. When you receive the notice to pay, you must pay the payment and submit through the email for us. After receiving the payment, your documents will be reviewed. In case the product is classified as a medical device, the applicant will receive classification letter to be used for every importation request. In case the product is not classified as a medical device, an email will be sent to applicant clarifying the reason of the not classification the medical device. Also, in case there is any missing document, an email will be sent to applicant with recommendation, if any. Please note that if there is any missing document, the submission for the missing document is due to the 3 times. After the 3 times, it will be a new request with a new fees. Getting a classification letter does not mean that you can import. You should apply on the offer system also. Thank you for your kind attention.
Thank you. Thank you very much, Sabika. I'll be now presenting the medical device legislation, and then we will answer your questions. Please share your questions in the Q&A box. The module that we're covering today is the medical device legislation, and I will be covering 2 resolutions that was recently published. The resolution number 24, which is related to the fees, and resolution number 48 related to medical device compliance and quality assurance. And then we will look into the implementation and enforcement timeline that I'm sure many of you are waiting for the dates and timeframes to enforce it. When we talk about fees, to those who already viewed the resolution, there are 4 main services: medical device registration, facility registration, medical device importation, and other services. When we talk about medical device registration, as Engineer Abdulatif and Ms. Saida explained in the second module, the fees for submitting medical device application will be 5 BD per new device. So for the old application before this resolution, this fees is not applicable. For new applications, it will be only per new device. You will find now the differences between tables and fees, and I will try to elaborate more on it. Then after we receive the application, make sure that the payment is done correctly and we are 100% that the product is in compliance with NHRA requirements. Before we issue the certificate, the fees of registration, which is for low risk, if it's the first time, will be 150 BD and so on as presented in front of you. The fees is annual payment per year because the license itself is also with 1 year validity. Then after issuing the certificate, if there is any variation to the device itself, the fees for variation will be 20 BD per device. When we talk about a device, it is the device itself. Please don't get confused between it and importation criteria. I will explain that now in the coming slide. Facility registration, we mean by facility as the authorized representative, the importer, the first module that was covered by Engineer Umar. And we also have the warehouse and the manufacturer registration. Same goes in this service. The first application, only the first time you need to pay 50 BD per request. And then only after finalizing and before issuing the certificate, the fees of the license must be paid. Same goes with the warehouse and the manufacturer. If there are any variations after issuing the certificate, 50 BD must be paid. And in some cases, normally all the applicants are fully aware of the inspection criteria. In some cases, if a re-inspection visit is required, a 50 BD must be paid before paying that additional visit. Now going to the importation covered by Engineer Abdullah and Mr. Abdullah, the fees for medical devices importation was explained by Mr. Abdullah Said yesterday, and the video of the fees is available on our website for you to revisit if there is, if it's not yet clear, or you can also raise a question in the Q&A box. So what we have done is we've structured it. If the device is registered, this is the fees. If it's not registered, this is the fees. If it's combined or an IVD medical device fees will be as shown. And this verify the validity of the quality certificate. I know many of you have asked us and we've explained it in the previous workshops, but let me explain it today also. Some of the applicants face some difficulties verifying their quality assurance certificate. And we've tried yesterday to have more than one example, but in some scenarios, some cases, the applicant cannot verify and they need NHRA to verify the certificate for them. Then you can apply for quality assurance certificate verification, and 5 BD will be done per type. And let me just elaborate more about per type and per device. Yesterday, Mr. Said explained per type, it doesn't matter the size of the device, the color of the device, all of it is considered as one type. Whereas in medical devices, in medical device registration, per device is a bit different. Then we go to the product classification request, as Ms. Sabika just explained. The demerit for the device till approval, this is a conditional service. We all know that you need to first get the approval of NHRA before you ship the device. But in some cases, if the device is shipped and the importer does not want to keep the device at port, wants to keep it with NHRA, the payment will be 100 BD per day. And the fees is a bit high because we want to avoid this kind of a practice. Issuing a product classification certificate, we normally issue it digitally, but if you want us to issue a certificate in a certain template, print it out, the payment is 15 BD per certificate. Sample examination, yesterday Mr. Abdullah explained about the medical devices that require examination at the port of entry. So it will be also per type, 5 BD. If it's a big device that can't be brought to NHRA and we have to go physically at the port, it will be 10 BD per type. So inspection is not done for every medical device. It is done selectively on certain cases only. Permit to use medical devices. Tomorrow, Mr. Khalid will be highlighting this service. So this is for healthcare facilities, not for the importers. And it will be only half a dinar per device, only at the end of the cycle. Evaluating the valuability of the device. If the device is very old and the healthcare facility wants us to go and evaluate whether they can still use it or not, it will be 50 BD per device. Issuing a certificate for medical device manufacturer, free sale certificate, or any other certificate that you require us to print it out, which is not mentioned in the previous table, will be 10 BD per request. And supervising medical devices disposal will be 25 BD per request, not per device. We have uploaded every useful document on our website. Please have a look at it. The entire document that you need, the entire questions that is being, let's say 80% of the questions raised is all answered on our website. There's a video over there also for you to have a look at it, and I hope it answers all your questions. If not, feel free to drop an email to us, and if we can answer it or maybe have a meeting to elaborate more, we can do that. Now, the second point is the resolution number 48. This beautiful illustration about the resolution itself was done by one of our team, but let me go into depth this time and with the main point, which is the registration. What is it highlighting? It is actually putting a legal framework of what we have been doing since 2016. All medical devices purchased, imported, or marketed must be registered. Certificate is valid for 1 year, or as per the QAC, whichever is first. Non-compliance to regulation, including proper storage, results in registration cancellation. Import and export. Every medical device regulated, as in the HS code is regulated, must comply with importation requirements. Importer is responsible to maintain the compliance even after importation. So if the device was imported and we've discovered that it was not transported, was not stored in a proper manner as per the manufacturer requirements, the responsibility will fall under the importer himself. NHRA has the obligation to take action against importer license in case of non-compliance. So it can affect the activity itself. the importer may no longer be able to import if it's critical. Including importers, distributors, and local manufacturers, the facility registration, all must be registered based on NHRA regulations. So the existing manufacturers before this resolution, we will work hand to hand with them to register them, distributors and importers also. And they must market and sell medical devices to a licensed healthcare facility only. So even after we license the facility, after we give the approval for the medical device, register it, and give the approval for importation, the importer or the authorized representative is responsible to make sure that their device is delivered to a licensed healthcare facility, not to a non-authorized person. With regards to permit to use, all healthcare facility must first obtain permit to use, and this is what we're planning to do on a gradual process. Hopefully, by the time of the deadline that I'm going to explain in the coming slide, all medical devices, active medical devices, will have the permit to use QR code. Stages of permit to use will be explained tomorrow, and it does not include the disposable medical devices or a single-use medical devices. Post-market surveillance, medical devices with corrective safety action or recall must be reported as per the timeline set by NHRA. Failure to comply is considered as putting patient safety at risk. A legal action will be taken, and it might lead to a license cancellation or even more, depending on the consequences that this delay caused. If it caused death, la samahallah, God forbidden, it will cause more than this legal action. The last part of my presentation is implementation and enforcement timeline. In summary, this is how we are planning. I know there are many questions when everything is going to be enforced. So in 2021, we had the resolution. In 2022, inshallah, all CRs with medical devices, importation, medical devices, storage, medical devices, manufacturing must be registered by December 2022. The rest, their CR will no longer be active and they will not be able to practice their activity. This deadline was given in 2018. By 2025, bi'idhnillah, we will have the full medical devices criteria under the criteria of permit to use finalized. We might look into extending it because of COVID. Many of the healthcare facilities were not able to proceed with us, but this is the initial time frame. In 2026, all medical devices, February 2026, all medical devices must be registered. And if it's not registered, you cannot import the medical device. So to those who misunderstood the time frame, it is not posing the medical device registration. You have until 2026 to register your medical devices. As for the advertisement, it's not yet clear because there are more important points to cover right now. If there is any time frame or deadline, we will announce for it. That's all. We can go now to the Q&A. Ms. Sabika, are you ready?
Yes.
Okay. So the first question, the legal manufacturer is in US and our notifying body is in Netherlands. Could we use the free sale certificate issued from Netherlands? Can you tell them what is the requirement for a free sale certificate if the product is manufactured in USA?
If it's the manufacturer in the USA, they have to provide the FDA for the product. should be registered in FDA.
Yes. And as an additional document, because in the classification we ask for both, you can provide the Netherlands, but it is necessary to have the FDA.
The first performance.
Yes. In case a relationship letter requirement for classification, is relationship letter requirement of the classification?
Yes. Yes.
Should it be issued by the legal or physical manufacturer?
Should be from the legal manufacturer. State that is that this product this is the physical manufacturer. We are handling with them.
Yeah, so only in importation, to those who are a bit confused, only in importation we're asking for the relationship letter from the physical manufacturer.
No, in classification also we are asking for relationship letter, because when I'm issuing the certificate
from the legal manufacturer or from the physical manufacturer?
From the legal manufacturer.
So in importation, it is only requested from the physical.
Yeah.
Okay. What about fees for consumables, item which are regular?
20 BD. 20 BD.
Yes. I'm not sure, Meta, if this question is related to us, to classification, or what exactly. So please elaborate more, because this is a bit vague. Okay. Again, please, if you're asking about fees, make sure that you are mentioning the service, because it differs from service to another. Okay, now one question about destruction, which is for me. Engineer Umar, are you with us?
Yes, engineer.
Okay, so I will just try and filter my questions.
Yeah.
Okay. And I will try and see if there are more questions for classification. I think they're all for. Okay, what is the time frame, Mr. Bika? What is the time frame for classification?
1 week. It's a maximum. If it's all they submit all the documents. If there is any missing or more information, we can take 1 to 2 weeks only.
Okay, free sale certificate must be issued to a reference country, not necessary to Bahrain. I think they've misunderstood. Free sale certificate from a reference country, but the free sale certificate, Mr. Bika, should be issued to Bahrain?
Yes.
Okay.
Yes.
Yes.
Can I say something?
Yes.
The NHRA, one of our reference countries, the NHRA, they are issuing the certificate for the experience, for the Kuwait, for Emirates. They can issue for the Bahrain also.
Okay.
Get my point.
Okay, there is one question also for you, and I think we're done with the classification. And I can hand it over to Engineer Amar. In the slide of what should be classified, it is mentioned new product. That means any new product intended to be registered, we need to classify it, or if it overlaps with other types. So what do you mean by new product in your slide?
A new product is like a drops, ear drops, or nose drops, or any kind of drops as spray. Sorry?
A product that was not imported before.
Not imported before. Yeah.
Okay, and I know that you've mentioned on the website there is a document that can help the applicant to know whether this needs classification or no.
Yes, there is.
Okay. Okay, so there are no more questions yet for classification. Engineer Amar?
Yes, engineer. So I'll start with the first question regarding devices type FT3 and FT4. Free thyroid hormones can counted as one type?
Well, it's a big, vague question. So maybe the person who asked this question can elaborate more to us, because we need to know what is the difference between FT3 and FT4. Is it a size? If it's only the size, if it's only the color, then it will be considered as one type.
Thank you, Engineer. Second question is, would there be different time limit to register medical devices depending on medical device classes other than 2026?
Now, by 2026, all medical devices regulated, which is mainly class 2 and class 3, must be registered. We're not focusing now on registering class 1, as Engineer Abdul Latif already mentioned. So we're talking about class 2 and class 3 by 2026 must be registered.
Okay. Next, is Wi-Fi cloud application that controls and monitoring medical devices and non-medical devices as separated device will be considered as medical device?
Well, then you need to provide us with documents to know if it's a medical device or not based on the classification criteria, because the mode of action in here is not clear to us. Okay, it is with the features Wi-Fi or cloud, but what does it do?
Okay, then is the responsibility of the agent to check if the healthcare facility has added a new scope to their service before supplying to the facility?
Yes, all the ARs, all the companies with an AR license initially signed an obligation letter. Even in the form it is mentioned that they will make sure the facility that they're selling the device to is licensed. Let me give you a scenario for those who are not familiar with why we need to do this. If I'm selling a device, let's say surgical device, to a facility that doesn't have a competent person to operate on it, you might say that, okay, I will train him, but he doesn't have the license from NHRA, he's not competent enough to work on the device on the patient, then you're putting patient life at risk. So it's a shared responsibility, and that's why you need to make sure that they are licensed by NHRA.
Thank you, Engineer. And regarding, regarding the medical device registration fees as their devices, if the file has more than one device, means we will pay more than one time?
Okay, so here we're talking about the application fees, right?
Yes.
Yeah, so with the application fees, it's clearly mentioned per device, and the amount is very low. It's like 5 BD per device. So yes, it will be per device, and then the license will be for all the devices. So the license will be once. If they're all bundled in one license, the fees, like let's say 150 for class 1, it will be once.
Another question says that please confirm if we have a wide range of similar products, can we present a free sale certificate that covers the general scope of items under the same physical manufacturer without including product code or exact description?
No, I'm not sure I understood the question.
If they have a wide range of similar products and they have free sale certificate that describes the scope but does not mention the specific product code or exact description, is it going to be accepted? This is...
So yeah, maybe this is for classification.
Yes.
Yes, Sabika, are you with us? So when they submit the free sale certificate, do they have to mention the code or the general scope only? You're muted?
Yeah.
Oh no, you're not muted.
Yeah. Once again, sorry.
Okay. So when they apply for a free sale certificate, do you accept they only write the scope? Like let's say, for example, eye drops, that's it. or they need to write the name, the exact name and the code?
لا, it should be with the manufacturer name, the product name, with a code.
So general scope is not accepted.
Not accepted.
Okay, thank you very much. Again, please, if you're referring to the previous question, try and mention what is the question that you're referring to, because it's not clear to us. Okay, we can see if there is any live questions. If you want to ask us live, please raise your hand so we can enable your mic. No one? Yes, Mr. Adel Munib. You can unmute your mic.
Yeah, hi Nada, hi Sabika, hi Omar. It's Adil from Global Consultancy. Actually, I will second the earlier question, which was FT3 and FT4, because in a laboratory, there are, under one manufacturer, there are 10 type of kits. Like in histopathology, under one kit, there will be 10 type of tests. So we will register only one as a Leica manufacturer, or like different kits, different tests.
What is the difference between each kit?
Let me give you the example of histopathology, like the antibodies. So all antibodies, some is for skin cancer, some is for breast cancer, some is for tumor, neurocancer, some is for brain cancer. So we will register each antibody one by one,
Okay,
or
so,
the only Leica antibodies, because if we do by one, it is coming more than 1,000 types.
okay, to help you more, let me just, I'm
Please.
trying to generalize my question and not specify it to your example. On
Thank
our
you.
website, thank you. On our website, we have in the guideline itself a flow chart. You can ask yourself a question and go step by step. This will make it easier for you. If I will answer only this, then it will not help you that much. But the flow chart itself can help you find the proper answer. It doesn't make sense that you will have 10,000 certificates. It's not practical, and that's why we have the bundling method. So under bundling method and registration, there is a detailed chart for IVD and for active medical devices. You can go through it and follow the steps over there. If it's still not yet clear, please drop us an email and we can have a meeting and explain it to you.
Thanks a lot. Thank you. Thank you.
Thank you very much. Okay, there is one question about the validity. It's a bit long, so I'll just summarize it. If you allow me for this, yes. So what they're asking is, I've mentioned that in the legislation, it is stated that the duration of the certificate is 1 year, or as per the QAC validity. But what we are implementing is 1 year. So as per the QAC validity, normally there are 3 years, whichever is shorter. So the shortest thing is 1 year. And nobody will come and pay the fees of the entire device with less than 1 year validity. And that's why we've standardized it. So it is mentioned at the end, whichever comes first. So 1 year is normally the least duration or the less duration. Do we have with us Engineer Abdul Latif?
Yes.
I think there is a lot of questions about bundling. So maybe tomorrow, if we finish early, you can have like the flow chart to be explained, if that's okay with you.
Sure.
Because I think it's a bit not yet clear to them about bundling method. We'll
Sure,
have
no problem.
Latif and Engineer Abdullah about the verification. Let's hope tomorrow we'll finish early to have those two topics. Any more questions? Yes, Ms. Hadil, you're raising your hand. Svetlana, if we can activate her mic, please. Yes, you can unmute your mic now.
Can you hear me?
Yes.
Yes, hi. So I regarding the question that was about the wide range of products for classification.
Yes.
Yeah, I want to elaborate on that more. I'm going to give a clear example. If I have, let's say, products A to Z, okay, and all those products are with the same intended use, but are have, for example, different concentrations, but the same intended use. In this case, every time I'm going to import, let's say, one product at a time, do I have to ask the supplier for a free sales certificate for every single product? Because will I be going through classification every single time? Or could I just apply once for classification and ask the supplier to provide a free sales certificate that covers the let's say, scope? But when I say scope, not general scope, I mean, for example, the scope that covers items used for example, this device, or items used for this specific intended use.
Okay.
So on.
Yes, so let me just, thank you very much for your question. Let me just reframe your question for Ms. Sabika. Ms. Sabika, are you with us? Yes? Okay. So what Ms. Hadid is asking, if I have a huge amount of items that require classification, is there a shortcut for me, for example, to put, let's say, Ms. Hadid, what was the example you've given? Do you have an example?
For example, yeah, I'll give, for example, I give you two examples. You can choose any one of them. For example, I have items A to Z with different concentrations.
Yeah, what the device itself?
Okay, I'll give something more clear. Let's say radioactive. Let's say quality calibration.
Okay. So let's say she have a radioactive material with a huge range from, let's say, this dose to that dose. If she can put them all in one free sale certificate and get the classification, can she do this at the time of classification, or every single dose has to be classified separately? And make it more clear, if we're talking about eye drops, okay? 2 ml, 3 ml, 10 ml, whatever. I'm just trying to make it general for everybody to make use of this question. Can I provide you with an eye drop free sale certificate stating, let's say, for example, the range at least, okay? That eye drops from this range to this range all falls under this free sale certificate. Will you accept that?
But note that the different concentrations have different product codes.
Yes, for sure.
Yeah, we accept that one. If it's if she have one free sale certificate and it's mentioned 100 products with a different code, different types, we can accept this one.
So you need the codes to be mentioned in the letter once,
Yeah.
and submit them all together.
Yes, it's okay, Yani.
Okay, Ms. Hadid?
Okay, so just to make sure, I need the product codes to be present.
Yeah.
Yes. Is there any limit, Ms. Sabika, because there's another question in the Q&A. Is there any limit for the medical devices to be listed in one certificate?
If it's same type and same intended use, we can add it a 10, maximum 10 products in one certificate, one letter.
Okay, so the limit is 10.
Yeah.
But if it's a range from this range to that range, then we can just put it all with all the range. Like this is the minimum and this is the maximum. Okay, any more questions? Okay, so with no more questions raised, we will see you inshallah tomorrow. Please try to be 5 minutes before 3 o'clock, so at least we will not waste time waiting for participants to join. So at least we can make use of the time spared at the end, and we can have 2 additional presentations from Engineer Abdullah Dusri and Engineer Abdul Latif. Thank you very much. See you tomorrow, inshallah, for the last day of this webinar. Thank you, Mr. Bika and Engineer Amr. Ma salama.